ESMO has put out a new guide for patients, which translates clinical practice guidelines that medical oncologists use into a language that is patient-friendly. Please comment on what you think is most important for the patients when it comes to using these guides.
Yes, from the ESMO we decided that it's a high priority to produce these guides for disease-specific topics because we have guidelines for the doctors that are not comprehensible to the lay public, and so we decided to translate that into lay speak. And I guess it will be one of the most important achievements if we have a whole set of these guides for all the important tumors. Then we have this guideline we produced for the patients with advanced cancer, and we should also plan a guide for cancer survivors with all the tips and tricks and the caveats they have to observe. And then a quick response to Anita Waldman. Having direct contact with the trial leaders is certainly a good thing, especially for rare diseases. But if you do the same for colon cancer and for breast cancer, I'm not so sure how the trial leader will be flooded with emails and requests.
You could have someone who can guide the patients to the several hospitals or clinicians where the trials are ongoing. So I think we have this problem as well with lymphomas. There's a huge amount of ongoing trials, but there's one person who can guide the patients to this.
The main question is who is responsible for the information? And of course, this starts with the university. They have another job to do. But I believe, especially the urologists with the EAU, the scientific associations, they are responsible for providing information and education of the patients. It works wonderful. And I must say I'm very optimistic because, like Dr. Jost said, we have this in front of us. I send it around to our members, and they are all extremely happy. So the question is, the associations have to pick it up, and in order to do better, maybe they should involve some patient groups before they ever start editing.
The guide tries to empower patients to give them to give them the skills to know what are the important questions that they need to be asking their doctors about their illness and about the treatment options available to them. Part of this is going to be, some of this is going to be challenging for doctors because they're not. So some oncologists will not necessarily be used to having patients with such an appreciation of the issues that are involved and the information that they need. On the issue of decision making, it addresses in fairly substantial detail issues of where to get information, how to use the internet, with all of the appropriate caveats about the reliability of sources. It addresses the sensitive issue of getting second opinions, which is often not addressed. And what is the politics of second opinions? What are the questions to ask? How do you communicate your desire to get a second opinion to your treating doctor? It addresses issues related to complementary therapies, as well as some of the tougher issues associated with survivorship, of dealing with issues of relapse, of incurable disease, of how to find the appropriate balance between one's cancer care and one's life, and then the aphorism of needing to hope for the best but prepare for the worst. But what does prepare for the worst mean, and how does one translate this into a reality which is going to be meaningful for oneself and for one's family members? We're really glad to have the support of so many of the organizations involved. I look at this as a first edition of what will be a living document, and I'll be very much interested in receiving feedback from users, from organizations around the table as to how we can improve the booklet. And yes, it is going to be produced in a very wide range of languages, and we're glad we're getting sponsorship to do much of that. So I really see this as the launch of a very exciting and ongoing and empowering project.
I would like to add something Professor Denis mentioned. He said there was a role for the scientific associations to in producing and developing information, patient information. I think we have to take into account the different developments and histories in several countries, because there have been established different ways of collaboration between organizations. And it could be, when it comes to clinical trials, for instance, it could be the scientific associations, but it could also be comprehensive cancer centers who are in charge of the developing of the clinical trials, and cancer leagues and patients' organizations, for instance.
I think it's now very well established that cancer patient organizations are the best to just make up products for information tools for cancer patients. But it depends how cancer patient organization works. We have a very good example in Italy, because we have been doing a lot of international work, but translation is not enough. You have to adapt to each country, so it's not just a simple way. The problem is to get together the scientific society, as we did, the highly specialized center for cancer care, as we did. So now we have more than 50 booklets, a website, and more than 150,000 booklets have been downloaded. And in the cancer plan has been included that now our system is became a national information service to whom belongs more than 40 centers that are the best in Italy. So we are realizing a kind of information that is the same all over Italy, and more centers will join us. And I think that the interaction between scientific society, highly specialized center for cancer patients, are the best way of doing this kind of work.